Hello everyone. Today we are going to see the management of the cardiac arrest. Okay. What are the immediate management we should follow in a cardiac arrest? See, cardiac arrest is so common nowadays that we don't have to wait for the the etiology for that age, sex matters, this matters, that matters. No. Cardiac arrest is so common nowadays that it is affecting our day to day healthy life, or we can say day to day stressful life. Both can be termed as. Okay. So why this is happening? Why are the people all around affecting by this cardiac arrest? So the answer is, see, there are many etiology factor for this, that why is this cardiac arrest being so common nowadays. So uh, what are the management we can do? Okay, immediate management is so important, that whether you are in the hospital, whether you're outside the hospital. Okay, some points you need to understand, basically basic to basic. Okay. Yeah, so now we will start it. Management of cardiac arrest: immediate identification of the cardiac arrest and activation of ERS. Now, now this is ERS is the emergency system. Okay, we have to call them, and we have to tell them that there is a person, like. Okay, so now what are the further thing? Early CPR. Now, what is CPR? See, CPR is the cardio pulmonary resuscitation. It is bringing back the things. Okay, bringing back to the normal cardiac output. What is the ratio for this? 30 is to 2. Means 30 push and 2 breathes. Is that okay? I will take a brief lecture on this in the next of my topic. But what is the early CPR? That is 30 by 2. It is so very important, students. So very important. Now, BLS. See, what are the basic life support for this? Once everyone should know this. Not a medical field, not a any IT field. This field, everyone should know CPR. A small sweeper also should know what is the CPR. A point in CPR. Now see, circulation, chest compression, push hard, push fast. See, there should be no disturbances in CPR. You should give a proper CPR, that is push, 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 push hard, push hard, push fast, push hard, push hard, push fast. Okay, yeah. Now see, this all we go for the basic life support. Now continue for 2 minutes before reassessment of the rhythm. Now see, if the rhythm is back to the normal, it's okay. But if rhythm is not back to the normal, we have to continue CPR. Okay. Okay. We will not be having a discontinuation in this CPR until the emergency system arrives. Okay. AED arrive होने तक हमको नहीं रुकना है, हमको उसके आगे भी बढ़ना है. Okay. Now, the next most important thing, airway. Clear the airway. Okay. What is the airway management for this? What is a clear airway? मतलब क्या? Clear airway मतलब head tilt, chin lift, jaw thrust, finger swap, hem lynch manual. See, very important. Head tilt मतलब what the airways are, the our nose, the trachea, the the all that airways. When the air doesn't passes through the lungs, we have to think about that there is some obstruction in the air. So first and foremost, clear the airway. Just head lift is, lift your head and just lift your chin out there, tilt out. Jaw thrust. See, is there any any jaw obstruction, something is there, look for that. Finger swap. What is finger swap? See, make your finger swap. Are you unable to gargle your fingers in that or not? Now, breathing, mouth to mouth should be the best way to make person awake. Now, what are the airways? Important. What in what you can help in this airway? See, face mask, ambibag, oropharyngeal airway, LMA, ET2. LMA is laryngeal mask, airway. Okay, very 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 important. If you are in a hospital setup, you should and you must have this face mask, embo bag, oropharyngeal airway, LME, and the ET tube, that is endotracheal tube. Now breathing. See, uh, what should be breathing process? The process should be the supplement oxygen. Okay, O2 means supplemented O2 should be given. Supplemental oxygen should be given. Okay. Now circulation. What are the important tricks when we are in a hospital? What should be done? See, immediate IV access, attaching the cardiac monitor, assessing the vitals, the BP. Again and again, again and again, again and again. Assess the rhythm. Are the rhythm back to the normal? Are the rhythm visible? Are the rhythm audible to us, seen? Everything. And defibrillations. Defibrillation are the machine that every hospital setup has. Now, most important, drugs. Okay, so what are the immediate management drugs for the cardiac arrest? This is so very important questions that this this can help someone in regaining his life, regaining his breaths. Okay, so what is that? What are the drugs and what are the important mechanism under the which every drug and every hospital setup should have these drugs? Drugs are adrenaline, okay, vasopressin, amiodarone, MgSO4, and atropine. Most important, adrenaline. Okay, everyone should have this. Vasopressin, amiodarone, MgSO4, atropine. At least remember the names of this important. If you don't know the doses initially, no problem. At least remember the names of this no, drugs, so that it can help you in managing someone's life back to the normal processes. Okay. Now, after administration of this drug, not all, there are the sequence for the administration. Now defibrillation. Okay, what is defibrillation? See, defibrillation, it is a procedure. Defibrillate the patient means to apply a application to bring back the rhythms. Okay, we can say bring back the rhythms. There can be AED machine, we can say. Okay, through AED machine we can defibrillate the patient. So there are two types of rhythm, shockable rhythm. Okay, what are those two types of rhythm? VM, that is ventricular fibrillation, and pulseless VTAC. What is pulseless VTAC? Pulseless VTAC is pulseless ventricular tachycardia. See, these both are the shockable rhythm. The AD machine itself will tell you this is the rhythm shockable, or is this rhythm not shockable. Okay, according to that, these procedures can be happen. Yeah. Now, post resuscitation care. What are the post resuscitation care? Means once you have resuscitated the patient is back to the normal. What are the other things we need to do? Mild therapeutic hypothermia for resuscitated cardiac arrest victims who are hemodynamically stable but remain comatose. See, what is hemodynamically stable? Means we can measure person's heartbeat. Okay, we can measure person's pulse, but the patient still remains comatose, means unable to respond, okay, verbally, ethically to us. So this is the care we need to take. Stable it, let it fine. Okay. Now long-term management after survival of the cardiac arrest. What after cardiac arrest? If once the patient is survived, but what can we do further? Okay. So what can we do is identify and treat the cause. Okay, identify and treat the cause. Example to give. Consider ICD in Bargara, syndrome initiating anti-arrhythmics. Okay, arrhythmics. Okay, this is an example posted. So just keep in mind what are the initial and healthy management for this. Okay, so it's very 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 important, children, for the better understanding, for the better learning, and anyone can do this, not a medical field, but CPR is a must. We all should know the CPR procedure. Okay, hope this video is good for you and you have learned the management for the cardiac arrest, which is very important to this era. Thank you.